Hey everybody, my name is Gillian Chase and I am currently a naturopathic medical student working towards becoming a naturopathic doctor. And today I want to share with you what the experience is like visiting an ND and how it may differ from seeing a different type of a doctor, like an MD or a DO. So before I get right into it, I want to clear up a pretty common point of confusion, and that is the difference between a naturopath and a naturopathic doctor. So a naturopath is someone who basically serves as a health consultant or as a wellness coach who can help you along your journey to better health. But they're not licensed to diagnose or treat patients, and they can't accept insurance. Where on the other hand, a naturopathic doctor is trained and licensed in most states as a primary care physician who can diagnose, help prevent, and treat chronic and acute illnesses. And the schooling to become an ND is pretty rigorous, and it includes many hours of working one-on-one with patients and also doing what are called preceptorships, which is where you work with established NDs in the field while you're still in school. And many newly graduated NDs will also do a residency following school. NDs can work in private or group practices, integrative oncology centers, medical schools, hospitals, research clinics, and much more. But while NDs can work in many of the same settings as an MD or a DO, they do differ quite a bit in how they actually practice medicine. And that's what I'd like to go into today. So the first major difference that I want to address is how much time an ND spends with their patients. You know, the average appointment time with an MD, a medical doctor, as a first-time patient is 15 minutes. Whereas with an ND, the average appointment slot is about 45 minutes for a new patient, but even sometimes 1 hour to 2 hours. And in my opinion, 45 minutes to an hour is just truly how long it takes to get a base understanding of someone's whole health, which doesn't just include what they might be coming in for today or what's happening physically, but it also encompasses mental health, relationships, money, resources, sleep, nutrition, stress, and the list goes on and on. And I think a lot of what gets cut out when you squish what should be 45 minutes into a 15-minute appointment time is when there's moments where a patient is sharing details about their lives and their environments that are really relevant to their health and also more personal aspects of their lives, like how their children are doing. That really contributes to building a strong patient-physician relationship. And I think that the minimum 45-minute appointment slots that NDs offer really allows for that establishment of a strong relationship between the provider and the patient. And with this relationship, a provider can treat their patients better because when you trust someone, you're more likely to be honest with them about your true diet, your exercise habits, maybe self-destructive tendencies or addictions even. And NDs really pride themselves in making sure that a patient knows that they're in a safe space, free from judgment, and they can be honest for the benefit of their own health. So the next big difference that I'd like to highlight is what aspects of a patient's health NDs focus on that other doctors may not put so much emphasis on. In the first visit with a naturopathic doctor, they'll go over your intake form, which might look a little bit different than an intake form you've previously filled out. Both will have a lot that's the same, but an ND's intake form may also include some additional questions, like asking about childhood illnesses that you may feel are irrelevant to your current health, traumas, physical but also mental or emotional, that are still impacting your overall health and well-being today, what your main stressors are, and your coping strategies, and any exposures that you may be aware of to potential toxins in your home or your workspace. And in the first meeting, the ND would also likely go deeper into how satisfied you are with your career, or if you have something in your life that gives you purpose. if you feel safe and loved in your relationships, if money is a stressor in your life, and if you're living in a space that you feel comfortable in. If you're a female-bodied patient, you'll also be asked in depth about your menstrual history because it is so relevant to your overall health. And based on your age, they'll likely ask if you've had some recent tests done, like a bone density scan, breast exam, cardiac stress test, colonoscopy, pelvic exam, etc., just to make sure that you're preventatively getting ahead of some of those common concerns for your age group and your gender. Okay, so next I want to speak for a moment on insurance and licensing. So some, but not all, insurance plans cover visits with NDs. You can contact the office of an ND and request to be pre-authorized for a visit to make sure that it'll be covered. Or you could call your insurance company and ask if your plan covers something called CAM, which stands for Complementary Alternative Medicine. And some NDs may only offer out-of-pocket care, but the majority will take insurance. And as for licensing, it is important to check your state's regulations of NDs and their scope of practice, as it does differ slightly state to state. And over the last few years, ND licensure across the country has spread pretty rapidly, and I think we're definitely moving towards becoming licensed as PCPs in every jurisdiction in the future, which is really exciting. So NDs who are PCPs can diagnose, treat, and coordinate your care just the same as an MD or a DO could, but they differ in how they go about treating a patient. An ND is trained to utilize a wide variety of treatment techniques to get you to better health, like herbal medicine, homeopathy, lifestyle and nutritional recommendations, physical manipulations or body work, or other traditional healing treatments. And we're trained to start with the foundations of health first when treating a patient. We make sure to establish a strong base of healthy eating, hydration, quality sleep, and movement or exercise. And then once we know that those are all very strong and the patient is still experiencing symptoms, then we'll explore if there are any barriers to self-healing. An example may be mold exposure in a patient's home, preventing their chronic respiratory illness from fully healing. If these barriers have been then removed and the patient is still not improving, there may be the need to support certain organs that have been damaged over time, like a sluggish liver or thinning stomach or intestinal lining. And we can support these through using herbs, homeopathy, things like that, things that are less invasive than maybe jumping towards pharmaceuticals or surgery. Or, if you need a physical adjustment, improving sleep and diet won't help if you have a rib out of place. So only when we've explored all of these options and there are still symptoms should we turn to more invasive measures, like giving somebody natural remedies to minimize symptoms, or even pharmaceuticals or surgery. We're taught to just make sure we're using the most appropriate and least invasive way possible to treat a patient. And I want to make the point that NDs are not against pharmaceuticals and surgery. I think that's a pretty big misconception that we never use or suggest them. These are just very costly options that unfortunately come with quite a few side effects. And if we can avoid them, we think we should, especially when we have less invasive options that will do the job. So the last difference that I want to highlight is the difference in the amount of patient education that takes place when seeing an ND versus visiting with another type of a doctor. I was blown away the first time that I shadowed an ND, and I watched them fully explain all of the options available to a patient, the cost of each of them, and why they would suggest one over the others for their unique case. I was used to previously watching MDs while I was shadowing them briefly explain their top choice pharmaceutical for the patient with really no other alternatives clearly presented. And in my own personal experience with MDs, I also was never told to try reducing my stress, healing my gut, or aligning my hormones to minimize symptoms prior to reaching for pharmaceuticals. And that may just be due to the lack of time to talk about those things with an MD. But my philosophy is, what's more important than our health? We should really be spending all of the time necessary to address those root causes so we don't do more harm than good, reaching for quick fixes instead. So along with patient education, NDs also make sure to truly empower their patients and talk about any barriers that they may have for their healing process to continue. And this allows the doctor an opportunity to talk about how they can overcome those barriers. If a patient is being told to eat healthier and they don't know how to cook, that's a barrier that the ND needs to address. The first step for that patient is then learning how to cook before they can begin to eat whole foods and eat healthier. So that's all that I have to share with you today. I hope this has provided you with some base knowledge about what makes a naturopathic doctor different than other doctors and what it may be like to visit one of them. But I'd like to end this video by saying that every doctor, regardless of if they're an MD, DO, or ND, is different. And what is most important is that you find the right person who can support your health in the way that you need and you want. So I've included a link in the video description to a resource that can help you find a licensed ND near you if you want to explore how naturopathic medicine can truly benefit your health. Thank you so much for watching, and please subscribe for more health-related content to come.